Kathrin again, welcome back. Today another session for you. You know that we have plenty of options in the CASIA2, almost too many options you might think. It's true, but we want it because every single doctor has a different way of using the CASIA and a different expectation. And because of this, I think it is very important to make the software as flexible as possible and also to give you as many possibilities as possible. We talked a lot of preset scans already for the cataract surgery, for glaucoma, and so on. We have different default exams that we are using. We have a global scan with 128 scans and so on. But especially in the glaucoma section and also some other specialized surgeries, you need eventually a higher resolution, or you need a smaller field you are scanning in the periphery, for example, if you want to scan any kind of a stent that you have implemented, for example. So there are a lot of different features and possibilities that we have, and we cannot put them as a default setting for everybody. So what we are offering are so-called customized scans. And these customized scans can be established by you. And I'm going to show you the possibilities we have about it. And of course, it is always nicer that you can try it later on, but I would like to show you today the possibilities we have. So let's go again into the setup on the left lower corner up here. Since we talk about a measurement, we go into the measure feature. And here already you have some settings. Normally these default settings, I recommend you to leave them like this. But we can, as you see here, customize the scans. So we click on exam protocol. There you can see our default ones. And if I go into the custom settings, you can do a lot of custom pre-settings. As you see here, we did a custom settings for Luzern in Switzerland. When we go back, we click on the scan type, and here we can add another scan type which you can name by yourself. So I'm going to name it like my name for the surgery. So Dr. Doolittle, because it's my favorite scan, and you can choose what kind of method, either a radial scan or a raster scan or a 2D scan. Now you're asking 2D, why 2D? I can do a 3D scan as well, that is true, but with a 2D scan you can increase the resolution, you can repeat a lot of measurements and get more information about it, and it's always about the time, and you want to see, I mean, the quicker the better it is, because you have less artifacts. And if you look at this corner here, you see the scanning time. So we can adjust the scan time depending on your settings. So you might choose a small, especially in the raster, you can choose a smaller area for the periphery, for example, only 4 millimeter. And also here, so let's do a square, for example. AB scan is the resolution per line. So we can, standard resolution in our settings is most of the time 800 pixels per line, but we can go up to 2000. And when I'll show this to you and you look at the time, you can see already a small difference here. We can choose how many scans, up to 250 scans are possible. So let's assume I want to do 256 scans, then you see it's a scanning time of 10 seconds with a resolution of 2000, which I would not recommend, but it would be possible for researchers or anything. Of course, I do not recommend this, but let's say we go to 64 scans, then we have 2.69 seconds, or I choose to reduce my resolution to 1600, then I have a smaller scanning time. So, or shorter scanning time, sorry. So you can see we are very, very flexible. You can also choose the scan direction as a default setting, but you can always choose also the scan direction if you go into the measurement mode by yourself. The fixation target can be a dot. Accommodation means we can add a spherical power to force accommodation. And we can also use an automatic alignment. The automatic alignment is actually not recommended if you do a peripheral screening, because if we assume that you want to scan the tube that you're inserting, normally a tube gets inserted up here, so you make the patient looking down, and with every patient this area is somewhere else. So an automatic alignment would not really work that well. So we decide to do it manually, for example, and then I have adjusted everything to my needs and I save it. And now I have my Dr. Dolittle scan inside, and I simply need to add this Dolittle scan in my exam protocols, in the customs, for example. So I go into the custom settings and I say edit. And then it is here, Dr. Dolittle. So that's basically it. See how fast it goes. I like this function a lot because you're getting used to the CASIA, you're getting used to all the default scans, and I think our preset scans are a lot. But I like this function because you can really go very detailed to your needs. And this is something which makes it very special. I hope you like it. Stay tuned for more information. Take care and talk to you soon. Bye.